This is Nate Morsches, president of RPG in downtown Lawrence. I'm also an RN, and that has weekly experience with COVID-19. This is a new weekly update we are going to start providing, not to replace any official source of information, but to help provide an on-the-ground perspective from a business owner and RN who lives here in Lawrence, Kansas. Let me start with some general COVID facts. The week before July 4th, cases started increasing dramatically. Kansas and Douglas County both started increasing at a rate faster than average. And multiple states have actually called Kansas a quarantine state, somewhere where if you visit it, you have to quarantine before going into the community. Also, masks are now required in Douglas County for all indoor public spaces as well as private businesses. I want to tell you a little bit about my experience in the hospital. I work in the emergency department, ICU, as well as all the other floors. And the interesting thing about what's going on right now is that there are a high number of cases, but of COVID in particular, but actually the acuity or level of sickness is actually lower. And so I was talking with one of the ICU charge nurses, and we just got to talking as to why that might be. Well, first of all, there are better treatments than back in March and April when we didn't know anything about the disease. We still have a ton to learn, but we are utilizing certain medicines which are more effective than the ones we were trying to use back in March and April. So Dexamethasone has really been one of the greatest meds in terms of treating COVID and helping people get better and make it through when the virus is attacking their system the hardest. Also, what we're seeing in a number of cases is that the vulnerable populations aren't the ones who are getting sick right now. I mean, they still are, but far and away the highest majority is people 20 to 30. They're going out to the bars, they're going out and partying in Florida and on the beach, and they're getting COVID faster than any other demographic. And so these people are set up to recover a lot faster than someone who's older, someone who has other autoimmune diseases, things like that. And so because of these two things, better treatments and the demographic that is actually getting sick, the cases are higher, but the acuity is lower, generally speaking. There are less people on ventilators at the hospital than back in March and April. Interestingly, the hospital is overrun right now, but not because of COVID. What I'm experiencing at my hospital is that back in March and April, they made a commitment to keep everybody whole, to keep everybody on staff, not put anybody on unemployment, and continue to pay full-time wages for everyone. But now that we're out of that time period where there were a lot fewer patients in the hospital in general, we're not allowed to do overtime. And now we're seeing what it's like when no one's working overtime. You're a lot shorter staffed. And interestingly, and very sadly, mental health issues have skyrocketed. In a way, it's not surprising because of how stressful 2020 has been, but the number of people who are coming through the doors in the emergency department with mental health problems, that number is just going up and up. And we are working with short staff to try and maintain that and take care of these patients. And it's overall just a very difficult situation. Talking about what we're going to do at RPG, we're going to continue all of our COVID precautions. We are screening people at the doors. We're not allowing anyone with a temperature above 100 degrees Fahrenheit in the door, whether you're employee or patron. We are sanitizing everything. Obviously, we're using gloves in the right way, not cross-contaminating everything. We even wrote new policies and procedures for COVID back maybe 2 months ago now. And because of these things, we're able to stay on top of it. We signed Explore Lawrence's, what's it called?
Promise.
Lawrence Promise, the Lawrence Promise. We've signed the Lawrence Promise. And additionally, with everything going on and medicine being so important, with healthcare being so important, at the protests, as an individual, I'm going out as providing first aid. I was just there today. You'll notice the Red Cross. There was a protest out at the Douglas County Courthouse. We were pleased to provide first aid to anybody who may have been injured. And we will continue to do that same thing, helping anybody who's hurt. Now, once again, we're not an official source, and we recommend looking to the local authorities, the CDC and the WHO, for the most up-to-date information. I'm Nate Morsches, an RN and president of RPG. We hope that you stay safe, happy, and healthy in this time, and that we all continue to work together to help Lawrence thrive.